Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
synthesis and release of catecholamines. So, catecholamines synthesis first. In the synthesis of catecholamines, first the most important step is the tyrosine hydroxylase is the rate limiting enzyme. So, first there is 5-hydroxytryptamine will form. So first in the catecholamine synthesis we have tyrosine. So tyrosine, in the presence of the enzyme tyrosine hydroxylase, it gets converted to levodopa. This levodopa, in the presence of dopa decarboxylase, it forms dopamine. This dopamine will enter into the synaptic vesicle, that is dopamine vesicle, and this will get converted to norepinephrine in the presence of dopa beta hydroxylase. This norepinephrine is released out into the synapse. So if this is the synaptic terminal, first tyrosine, in the presence of tyrosine hydroxylase, it forms L-dopa. This L-dopa, in the presence of dopa decarboxylase, it forms dopamine. This dopamine will enter the synaptic vesicles and it gets converted to norepinephrine. This norepinephrine is released into the synapse. This norepinephrine gets metabolized by monoamine oxidase and catecholomethyltransferase, and this norepinephrine will enter the synaptic terminal by norepinephrine transporters. Then so this tyrosine uptake is also seen. So the drugs which are seen in between are this tyrosine uptake. Uptake of tyrosine is inhibited by the drug called as mityrosine. Then uptake of then the dopa decarboxylase. Dopa decarboxylase is inhibited by carbidopa. Then the dopamine entry into the vesicles, this is inhibited by reserpine. Reserpine will inhibit the dopamine entry into the vesicles, whereas norepinephrine released outside into the synapse is inhibited by guanethidine and beryllium. Guanethidine and beryllium will inhibit the exit of norepinephrine to outside. Norepinephrine transport inhibitors are also present. So all these are the drugs which are important in uh, catecholamine metabolism synthesis. So catecholamine synthesis, tyrosine hydroxylase is the rate limiting enzyme in this pathway, and this tyrosine hydroxylase is used during surgical removal of pheochromocytoma. We use this tyrosine hydroxylase. All these enzymes which are seen in the catecholamine synthesis are non-specific and they act on closely related substances. For example, this dopa decarboxylase will convert L-dopa to dopamine. The same dopa decarboxylase will also convert 5-hydroxytryptophan to 5-hydroxytryptamine. It converts 5-hydroxytryptophan to 5-hydroxytryptamine. Similarly, it also converts alpha methyl dopa to methyl dopamine. It also converts alpha methyl dopa to methyl dopamine. So it requires high concentration of glucocorticoids reaching the portal circulation. Then genetic defects of phenylalanine hydroxylase leads to phenylketonuria. Then we also have a drug called as alpha methyl tyrosine. This alpha methyl tyrosine is used in the management of malignant hypertension, and this alpha methyl tyrosine is used in pheochromocytoma. This dopa decarboxylase has a cofactor called as pyridoxal is the cofactor of dopa decarboxylase. Then storage of catecholamines. These catecholamines are stored in the synaptic vesicles or granules in the adrenergic nerve terminals. The vesicular membrane actively takes up the dopamine from the cytoplasm, and finally it synthesizes noradrenaline with the help of the enzyme dopamine beta hydroxylase from the dopamine. So norepinephrine is produced from the dopamine by dopamine beta hydroxylase. This norepinephrine is stored as a complex in the ATP, which is adsorbed onto the protein chromogranin. So this norepinephrine which is produced, this is stored as a complex with ATP in the ratio of 4:1, and this complex is adsorbed to a protein called as chromogranin. Now this noradrenaline will get methylated and it gets converted to adrenaline and is again taken up by a separate set of granules. The cytoplasmic pool of these catecholamines are kept low by the enzymes monoamine oxidase, which will break down the norepinephrine. This monoamine oxidase is present in the synaptic vesicles, and this monoamine oxidase is also present in the synaptic terminals in the mitochondria. In the mitochondria, on the outer surface of mitochondria, monoamine oxidase is present. It will keep the enzymes of catecholamines in low concentration or in the required amount of concentration. Then release of carbonic anhydrase. In release of carbonic anhydrase, the nerve impulse coupled with carbonic anhydrase takes place with the help of exocytosis. So with the help of exocytosis, all the vesicles or all the catecholamines are poured out and they enter the synaptic synapse. Now, vesicles containing peptides, like along with them vesicles containing peptides like enkephalin and also neuropeptide Y. So these enkephalins and neuropeptide Y, these are also released along with these catecholamines, and these enkephalins and neuropeptide Y are called as co-transmitters. These co-transmitters are also released simultaneously. The release is modulated by presynaptic receptors. So this release is mainly modulated by presynaptic receptors, especially alpha 2, which are present in the presynaptic, which is present in presynaptic terminal. Then once the catecholamines are released into the synapse, some of the catecholamines will undergo reuptake by norepinephrine transporter. This norepinephrine transporter is present in the neuronal membrane, and it will transport noradrenaline by a sodium coupled mechanism. So almost 90% of noradrenaline will undergo reuptake with the help of norepinephrine transporter. This norepinephrine transporter is also inhibited by the enzyme, by the molecules like cocaine or tricyclic antidepressants will inhibit this norepinephrine transporter. The reuptake is possible for the termination of action of catecholamines. Then once the norepinephrine is released into the synaptic terminal, 90% is reuptaked, whereas the rest of the 10% will undergo metabolism by monoamine oxidase and catechol O methyl transferase. So if this norepinephrine, once it diffuses into the liver, in the liver it is acted upon by the catechol O methyl transferase in the liver and other tissues. In both these cases, either by catecholamine methyl transferase or monoamine oxidase, through various steps of reactions, at the end vinyl mandelic acid is produced. This vinyl mandelic acid is excreted in the urine along with some other substances like 3-methoxy 4-hydroxy phenyl ethyl glycol is also excreted in the urine. Along with this, metanephrines are excreted in the urines, and also normetanephrines and 3,4-dihydroxy mandelic acid. So all these are also excreted in the urine. So these metabolites are mostly conjugated with glucuronic acid or sulfate before excretion into the urine. Thus, these metabolisms does not play an important role in termination of the action.
Thank you and thank you for watching.